I wouldn't say I'm conventionally creative. I mean, my brother is a concert pianist. He's very creative. In medicine, we have to memorize disease processes and medications that we give, but you can really be creative in your application of those processes. It's like a structured form of creativity. It's all building on our education and our learning, and then being creative with that toolbox. It was difficult to deal with the beginning of the COVID pandemic. You feel a little helpless when you see these hospital systems that you're so close to in really a state of emergency. For our protection, we had to be pulled from rotations. I understood it, but it was frustrating because I felt like I could be useful in helping out. We're always focused on problem solving in the hospital setting. So being at home, just thinking about what we can do to help, that problem solving kind of kicked into gear, but just in a different way. The Jefferson COVID-19 Student Volunteer Initiative began back in March of 2020. One of the physicians that I've collaborated with quite a bit actually reached out to me directly. It was difficult for the staff to deal with the COVID pandemic and give each patient the appropriate time that they needed on the phone. Her patients were very confused, didn't have a lot of information about what was going on in the world, and they were calling the office quite a bit, and the staff was completely overwhelmed. So I worked with the department and the faculty there and the staff, and we came up with this program where we recruited student volunteers from all classes at Sidney Kimmel Medical College, and we assigned them some patients to call every week, and then we would give the information back to the department, whether or not they wanted to transition their visits to telehealth, or if they still needed to be seen in person, or if they just wanted to cancel their visits altogether, while providing that, emotional support. Word of this project got around the hospital, so I was being contacted pretty regularly about creating some more projects for other departments in the hospital. And it kind of snowballed at that point. We created a project development team of students that I lead. We help develop projects with various departments in the hospital. And I worked with IT to create this COVID student volunteer platform. All students at Thomas Jefferson University have access to this website where they can just browse various volunteer opportunities and directly sign up to volunteer for them through the website.
All I've ever wanted to do was help people and become a nurse. My mom is very proud of me. She tells me all the time, she's been a nurse for 42 years, and she was actually on a COVID unit for a while. The Jefferson COVID-19 Student Volunteer Initiative was something I was honored to be a part of. The opportunity presented itself for me to help distribute the COVID-19 vaccinations to the staff at Jefferson Health, and I jumped at the opportunity. Working in the COVID-19 vaccination clinic changed the way I see nursing in general. You don't realize how something so small as a vaccine is so important in the nursing world.
There's a lot of talk about the Jefferson medical student and the Jefferson student, and I think that really is the teaching of compassion and collaboration. This institution is very student forward. Through my education, I've had experiences where I've been collaborating with faculty members and the academic administration, which has helped develop my leadership skills.
Nurses will save the world. I see myself being involved in vaccinating against COVID-19 until the end. The real value of a Jefferson education is teaching confidence building. I can do anything I put my mind to, and I'm going to be a great nurse.
There really is no limit to what we can do. So, if you have an idea, just try to make it work. I feel like I can safely say when I graduate that I've made some sort of an impact, creating change and making a difference in our patient population and the community that we live in. That's really important to me.